We have more breaking news to tell you about. This one coming from overseas. British Prime Minister Boris Johnson just announcing within the hour England is going into a national lockdown until mid-February amid a rise in cases and the spread of that new variant of the coronavirus. The UK reported a single-day record in new cases today, and earlier, the United Kingdom became the first nation to administer the COVID-19 vaccine developed by AstraZeneca and Oxford University. Joining me now from London, NBC News chief foreign correspondent Richard Engel. He secured access to one of those locations in London where some of the first doses of the AstraZeneca Oxford vaccine were given. Richard, good to have you with us. Also, as we mentioned, breaking news there out of the UK. What more can you tell us about this lockdown that is being described as even more severe than the initial lockdown back in March?
So, this is certainly not the kind of day that people in this country were expecting on the first working day of 2021. They were hoping that this would be the start of a new era, the start of a new vaccination program, which began this morning. But then a short while ago, Prime Minister Boris Johnson came out and said that the cases are skyrocketing, that they have been increasing dramatically over the last week in particular. He said that the National Healthcare Service here could be overwhelmed if nothing was done. So he announced the start, effective immediately, of a new national lockdown for England. That means schools are closed, universities are closed, all of them except for extreme cases. He said that school meals would be distributed to those who can't, who rely on having their children get their nutrition requirements at schools, but that people should no longer leave their homes unless there's an extreme circumstance like seeking medical attention or to escape domestic abuse. So it is very similar to the lockdown that we had in March. There are some differences. Family bubbles, which were not here roughly a year ago, are being allowed this time. But effectively, we are going back into, in England at least, a new national lockdown. But the key difference is there is not necessarily an end date this time, but an end concept. He talked about how by mid-February they should be emerging from this if things go well and if this virus doesn't change again. And a lot of this has to do with this new variant, this new mutation, which the Prime Minister said is 50 to 70% more contagious than the previous coronavirus.
Quite remarkable there. Really quickly, Richard, do you have any news on the AstraZeneca Oxford vaccine? I know you had access to it today. How much are officials there hoping that, too, could quickly change the tide in the UK?
That is everything. That is the entire calculus. He said that hopefully they can get out of this new national lockdown, which he said will last at least until mid-February if things go well and the virus doesn't change dramatically once again because of the vaccination program. He hopes that by mid-February, this country will have vaccinated all of its top priority candidates. That is, all people over 70, all people in care homes, and all frontline medical workers. So everything is dependent on getting this vaccination program moving, and the main effort is now the Oxford AstraZeneca vaccine, at least in this country.
All right.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.